Good evening, class. My name is Crystal Thomas, and tonight I'm going to talk to you about Alzheimer's disease. My first encounter with Alzheimer's disease, I was 18 years old. I was taking a CNA class, and someone had called in and they asked me to work the Alzheimer's unit. I had no idea what I was doing, but my mom was the charge nurse that night. So I thought, what the heck, I'll give it a shot. As soon as I walked into the unit, of course, it was a locked unit. It was dark. There was screaming. It was almost like a horror film to me. There was a retired principal who was clapping her hands, yelling for the students to come on where there was no kids around. A retired superintendent who was yelling for us to get the chickens that were on fire that were running all over his bed and in his room. There was a Bostonian woman who um, would lay flat as can be in bed and quiet as can be. But the minute that you would go in and wake her up and let her know what you were doing, she would sit straight up and screaming bloody, something that you couldn't understand in her accent. And then she'd look you straight in the face and scream bloody murder and lay back down as slow as she could. There was a 102-year-old woman who was screaming out profanities all night long. But then there was also the people that would just lay in bed and smile and occasionally shake their head. They had no idea what they were smiling at or shaking their head for. Needless to say, I left that next morning, with tears in my eyes. One, I was scared out of my mind. What the heck had I just done? But two, I was also wondering what goes on in these people's brains. What causes Alzheimer's? Well, the sad thing is they don't really know exactly what causes Alzheimer's disease. It's still a very mysterious, I guess you could say, disease. But Alzheimer's disease was first described by Alois Alzheimer's in 1906. He was a German psychiatrist and pathologist. Alzheimer's disease is a neurological disease that causes atrophy in the brain, that causes cognitive decline and memory loss. Alzheimer's disease is the number one diagnosis of people with dementia. In the United States, there's approximately 5.5 million people who are diagnosed with Alzheimer's disease. Worldwide, there are 50 million people with the diagnosis of dementia, with 60 to 70% of those people being diagnosed with Alzheimer's disease. According to the the Board of Health and Senior Services, um, approximately 38%, over a 10-year period, there was a 38% increase in those mortality rates of people with Alzheimer's disease compared to the people that died of cancer, heart disease, stroke, diabetes. Those are the major causes of death, but those had actually declined in this 10-year period. There are three stages of Alzheimer's disease: the mild stage, moderate stage, and severe stage. In the mild stage, they may show some memory loss. They get lost in familiar places, difficulty dealing with money. In the moderate phase, there's significant memory loss. They may not recognize familiar friends, family, loved ones, um, and they can't cope in new environments. Like say someone just leaves their home and then goes to like their daughter's home, and it's something that's completely different. They may act out. They may get combative. They may get more confused, agitated, unable to express their needs. So, what goes on in the brain of someone with Alzheimer's disease? The exact disease is not fully understood. But in the brain of someone with Alzheimer's disease, they develop plaques and tangles. Plaques are made up of beta amyloid proteins. Tangles are made up of tau proteins. These proteins wrap around neurons and cause them to be unable to communicate. When these neurons are unable to communicate, it causes death of the brain tissue, especially in the hippocampus. There is significant atrophy and degeneration in someone with Alzheimer's disease, mainly in the temporal parietal lobe, as well as the frontal cortex, the cingulate gyrus, and the locus coeruleus, and the pons of the brainstem. So how can you tell when someone with memory loss has Alzheimer's disease? Memory loss in the first stages of Alzheimer's disease, they'll have short-term memory loss. Like they won't remember what happened even an hour ago. Um, Whereas their long-term memory is still in place, like their family, their childhood. Maybe at that time, they're kids, but in their minds, their kids maybe still, maybe 10, 20 years younger. As the disease progresses, there could be some, you'll notice like repetitive statements, misplacing items like in a non-common area, for example, putting their car keys in the refrigerator, um, getting lost in familiar places, like on their way to the grocery store and whatnot. Um, they may show signs like personality changes. For example, I took care of a preacher's wife who could cuss better than a sailor, and her husband would always come up to us and cry and apologize because she was never that way. She had never said a cuss word in her life. They may have some social isolation because they're uncomfortable in that setting. They don't know how to react in that setting. So, what are the risk factors of developing Alzheimer's? Some of the risk factors are people with Down syndrome. Why? Because there's 3 copies of the chromosome 21, which are 3 copies of the gene for the protein that leads to the creation of the beta amyloids. Females tend to have a higher risk of developing Alzheimer's disease. Why is that? We're not completely sure, but women live longer than men. People who have had severe head trauma, like football players, someone who's been, had several concussions, um, and also people that have led unhealthy lifestyles, sedentary lifestyles, uneducated people, obese people, smokers, people with hypertension, elevated cholesterol, diabetes. Many studies have also said that people with low education level are at higher risk for developing Alzheimer's disease. However, I would say probably 75% of the people that I've taken care of are very intelligent people, like multiple degree people. Um, I've taken care of professors, politicians, doctors. I've taken care of several doctors, and these people worked well into their life and were well socialized, traveled people, and they knew a lot. Um, they also say that Alzheimer's disease is familial, which means that it's hereditary. Um, the genetic factor for Alzheimer's disease is the apolipoprotein E gene. However, just because you carry that gene doesn't mean that you will have Alzheimer's disease. How do we diagnose Alzheimer's? Well, there's no simple way of diagnosing Alzheimer's disease. The only definitive way of diagnosing Alzheimer's disease is postmortem, whenever they do an autopsy of the brain. The doctor may diagnose Alzheimer's disease based on a cognitive assessment, like a mini mental assessment, a SLUMS assessment. They may do a CT scan, a PET scan, and then they may also do a spinal tap to test the cerebral spinal fluid for either beta amyloids or tau proteins to see if they're elevated. There's no definitive treatment for Alzheimer's disease. There's an ongoing study of Alzheimer's disease to see what they can do to treat or maybe even slow down. Doctors prescribe cholinesterase inhibitors to ease cognitive symptoms. Common medications that fall into these categories are like donzepil, um, oh, rivastigmine, and then there's other medications like memantine that'll be used in combination with donzepil. Donzepil. These drugs do not stop, however, they are known to kind of slow the progression. Lifestyle change is also a good thing that can be done, like a heart healthy diet, exercise, doing something that is um, intellectually stimulating, increased socialization. The life expectancy for someone with Alzheimer's disease is 3 to 9 years. However, most of the times, whenever someone is first initially diagnosed with dementia, Alzheimer's disease, the disease has already been going on for progression has already started, probably 5 to 10 years prior to. Um, most of the time, people do not die directly from Alzheimer's disease. They die because of side effects of Alzheimer's disease. For example, um, someone that has forgotten how to swallow, they may aspirate and cause aspiration pneumonia and die from that because then their body is not able to expectorate whatever they have swallowed. They can't take the deep breaths. We can't instruct them on how to get that stuff up. Um, in conclusions, there's not a complete understanding of what causes Alzheimer's disease. There's not a no definitive diagnosis or treatment um, at this time, but there's ongoing studies on what we can do to treat Alzheimer's disease. I hope I've educated you some on Alzheimer's disease, and I hope you have a great evening.